I'm the third child in my family, but I found myself as a first when I was born. My family lost my two elder brothers due to febrile illness, but not sure if it was due to malaria. But I had myself occasions of febrile illness, and that scared me and my family, and was diagnosed finally with malaria. And I was provided with oral medication. But on the next day, my fever continues, and I was taken back to the hospital. And I was provided with, the physician informed us that I had severe malaria, and I was provided with injectable antimalarials. But now you see me here in front of you fighting against malaria and saying malaria elimination work starts with me. As one of our colleagues from Zambia, Elizabeth, said, lack of access, easy access to care is still contributing for malaria deaths. Some families should travel a longer distance to get the care. Ethiopia had significantly reduced malaria deaths by only giving or increasing the accessibilities by training non-health professionals in the community to diagnose and manage malaria. This enables families to get care directly. But this can be strengthened and become more feasible if we can develop a simplified diagnostic and treatment tools. I've been working as a principal investigator on two single-dose drugs, one for relapse prevention and the other was for cure. This is one way of simplification of the treatments, and especially if it is less toxic and also it is child-friendly. Such kind of efforts makes me much optimistic for future malaria elimination. Recently, I met one of the clinical participants in malaria relapse prevention, and while he was in his job, and he told me he is at his current job because he participated in the trial. This participant had recurrent malaria since he was a child, and when he goes to the college, he has almost 2 or 3 times recurrence. That is every 2 months, 3 months times in a year. And he was to discontinue his education. By participating in the trial, he was lucky that he was able to get relapse prevention arms, and he continues his education and finalize. Ethiopia is not providing relapse prevention treatment because G6PD tests should be done before the treatment is given for hemolysis. And the G6PD test is a very costly, and it is a complex, and it needs highly trained personnel. So point-of-care tests should be available. And currently also we are working with past teams on point-of-care tests for G6PD, so for radical cure treatments like Tafnoki. So we need more strong efforts towards malaria elimination, the policymakers, industries, and scientists to make a simplified treatment and diagnostic tools. I hope with such kind of efforts, we'll see in the near future that no student will be absent from school and no deaths will be reported. Thank you.